Good day to each and everyone. We are here to discuss the etiology, pathogenesis, and the outcomes of the neurogenic shock.
Neurogenic shock is a condition characterized by loss of sympathetic tone due to damage of nerves after a spinal injury. So, neurogenic shock is also known to be a distributive shock, wherein it results from excessive vasodilation. So, whenever there is vasodilation, it usually corresponds with impaired distribution of blood flow, such as decrease in the volume and insufficient oxygen being carried by the blood to other organs, which can lead to hypotension. Sympathetic nervous system, or what we call the fight or flight response, is actually the main highlight of the neurogenic shock. The sympathetic outflow usually comes in the T1 to L4 in our spinal cord, and it sends signals to the other parts of the body, which is maintaining the involuntary process. These involuntary processes are said to be physiological, which is the process including the heart rate, blood pressure, respiration, digestion, and even sexual arousal. So the causes of neurogenic shock, first we have here is high-level spinal cord injury located at T6 or above. So what happens? The brain cannot communicate with the sympathetic nerves, so which leads to disruption of sympathetic messages being relayed in the T1 to L2, resulting to the loss of sympathetic stimulation and ability to stimulate nerve impulses. So if there is damage to the spinal cord, the patient is in a high risk of arterial dilation in all of the arteries of the patient in their body, which can cause decrease of blood pressure and blood flow. So without the sympathetic stimulation, there is a loss of catecholamines. Catecholamines is what we know to be the flight hormones. Example for this is epinephrine and norepinephrine. They are powerful vasoconstrictors and has a chronotropic effects. So the loss of catecholamines can also cause changes in the hemodynamics. So there will be massive arterial dilation, decreased oxygen delivery, and tissue perfusion. And there will be insufficient blood going back to the heart, since it will most likely just they would pull in the venous vessel. Another cause we have here is improper delivery of spinal anesthesia. It is injecting the anesthetic into the spinal nerve root, such as incorrect pedicle screw placement can cause neurogenic shock. However, there are certain cases that spinal injury during anesthesia is not caused by the conduct of anesthetic. Another cause is the toxins damaging the autonomic nervous system. When there is damage to the spinal tissues, it leads to neural exotoxicity because of high accumulation of calcium and increased reactive oxygen concentrations. Next we have here is transverse myelitis. It is a rare neurological condition caused by inflammation of the spinal cord and interrupts signals between the spinal nerves. So due to the inflammation, especially in the covering of the nerve cells in the spinal cord, what we call the myelin sheath, it is actually damaged. So this interrupts the signal between spinal nerves and the rest of your body, causing issues such as loss of sensation, movement, and bladder control. Another we have here is Guillain-Barré syndrome. It is an autoimmune disorder that attacks the body's own nerves. So patients with Guillain-Barré syndrome are most likely to experience neurogenic shock, since the nerves of the autonomic nervous system is greatly being affected. which results to changes in the blood pressure, heart rate, vision, kidney function, and even body temperature.
The pathogenesis of neurogenic shock. Neurogenic shock occurs when a patient has a history of spinal cord injury, where it can keep your body's ability to control its own blood pressure, heart rate, and body temperature. When the blood vessels aren't functioning properly and don't circulate enough through the body, it can cause neurogenic shock. Although there is no blood loss, the blood does not flow properly. The arteries begin to accumulate blood and the blood pressure sharply declines. The injury's stimuli affects the sympathetic nervous system.
As mentioned in the etiology, neurogenic shock is caused by spinal cord injury or spinal anesthesia or drugs. This injurious stimuli results issues to the sympathetic nervous system, which plays a role in controlling vasomotor tone. The sympathetic nervous system loses its ability to stimulate nerve impulses that regulate the diameter of the blood vessels and results to vasodilation. By vasodilation, the systemic vascular resistance is decreased and affect the cardiac output. The vessels are wide and doesn't have much resistance to move or push the blood forward and results to hypotension and venous blood pooling. Other things that affect cardiac output are bradycardia and hypothermia. In neurogenic shock, the sympathetic nervous system is not working properly. An unopposed parasympathetic nervous system leads to decreased heart rate, and it is called bradycardia. And because of venous pooling of the blood that prevents it from returning in the heart and extremities, the body temperature decreases and called hypothermia. These factors results to decreased oxygen output of organs, and if not treated, it can lead to death.
Alterations of the structures and functions of the body will lead to various conditions. One example is neurogenic shock. One of the morphologic changes of neurogenic shock is peripheral vasodilation. Also, the descending sympathetic tracts are disrupted most commonly from associated fracture or dislocation of vertebrae in the cervical or upper thoracic spine. Primary injury in the neurogenic shock is direct damage to the axons and neural membranes in the intermediolateral nucleus, lateral gray matter, and anterior root that lead to disrupted sympathetic tone.
Other morphologic changes includes vascular insult, electrolyte shifts, and edema that leads to progressive central hemorrhagic necrosis of gray matter at the injury site, accumulation or excessive stimulation of receptors, improper homeostasis of electrolytes, mitochondrial injury, and reperfusion injury. Overall, the body loses function and stimulation of sympathetic nervous system.
Clinical manifestations of neurogenic shock are extreme back pain, weakness or incoordination in any part of the body, numbness or loss of sensation of hands, fingers, feet, or toes, and difficulty with balance and walking.
A catastrophic side effect of a spinal cord damage, neurogenic shock, SCI, following a spinal cord injury, peripheral vasodilatation, cause a feeling of weakness, clumsiness, or a paralysis throughout your body. Your hands, finger, feet, or toes may become numb, tingly, or lose their sensation. A lack of bladder or bowel control, difficulty walking and maintaining balance, cause hypotension, bradyarrhythmia, and temperature dysregulation, which are all symptoms of the condition.
Neurogenic shock treatment and management. When the blood pressure and heart rate fall too low, the body does not have sufficient blood supply to function properly. As a result, poorly managed neurogenic shock can lead to significant cardiovascular and neurological damage. Therefore, treatment for neurogenic shock focuses on restoring heart rate and blood pressure to normal levels. So the treatment for neurogenic shock generally involves the first one, cervical collar. It is for spinal immobilization. This neck brace or cervical collar helps to prevent further injury in the spinal cord injury. So the second one is IV fluids. IV fluids are the primary treatment for low blood pressure. They replenish fluid levels in the veins to help stabilize blood pressure. What it's going to do is fill the dilated vessels and increase the venous return to the heart, which will increase cardiac preload and help play a role in increasing the stroke volume, which will increase cardiac output. The third one is vasopressors. If IV fluids prove ineffective, vasopressors can help tighten blood vessels and increase blood pressure. They will cause vasoconstriction because there's a major vasodilation in the blood vessels. Because the sympathetic nervous system is not controlling the vasomotor tone and the vessels are just relaxed, there needs to be something that will help the vessels contract and constrict. Vasopressors are going to increase the systemic vascular resistance where it was once decreased. When the systemic vascular resistance is increased, the blood pressure increases as well, and in the long run, increasing the cardiac output. So, commonly used vasopressors include norepinephrine, phenylephrine, dopamine, and epinephrine. These drugs will provide vasoconstriction and will increase the heart rate. So, the fourth one is atropine. If patient's heart rate is low, the doctor may prescribe atropine. It helps normalize heart rate by preventing parasympathetic activity. So other treatments may include placement of Foley catheter because some patients lose their bladder function and health practitioners don't want to retain urine, so it should be drained out. Prevention of DVT or deep vein thrombosis. The patients are going to do range of motion exercises, applying compressions, and administering anticoagulants. And the last one, patients should avoid crossing their legs and avoid putting pillow under their knees as it will compromise the circulation.